what Medicare options you have there as well. And then afterwards, we can do questions. And if you'd like to set up one-on-ones for a review, we can do that. Just take down my number on this next page here. And here's my number. So you can text this number, you can call this number, or send me an email anytime. I do Medicare all year round. I work with all major insurance companies. I work with Social Security offices to get your Medicare set up, or if you have issues with your Medicare, I do everything from step one all the way through. I was a veteran. I was in the Air Force for about 12 years. I did a few years active duty and then went full-time with the National Guard, and then a few years part-time. And now I'm currently out of the military.
All right, Zach, just a point of correction. You are not a former veteran. You are always a veteran from now until eternity.
Good point. All right. I am a veteran.
Amen.
All right. So first, we'll just talk about Medicare, what it is and what it's not. So Medicare is a health insurance program for individuals. So everybody has their own Medicare. It is not, if you're on it and your spouse is younger, doesn't matter, she cannot come on to your Medicare. You guys are completely separate. You can have one carrier, she can have the other, or vice versa. And it is partially funded by your taxes that everybody pays. I think it's roughly 3% that you pay in. Your employer pays half, you pay half. And then that gets you partially in the door, but you still have to pay for the other part, but we'll go over that. Who can get Medicare? All US citizens and legal residents are eligible for Medicare once they reach 65 or older and have lived in the US for 5 years. So once you're 65, you can enroll in Medicare, or if you're younger than 65 and you've had a disability, qualifying disability for 2 years or longer, you get enrolled into Medicare. And then two other ways would be if you have kidney failure or ALS, Lou Gehrig's disease. When can you enroll? So there's an initial enrollment period. This is 3 months before your 65th birth month. For most people, if your birthday falls on the first of the month, you actually get Medicare a month early. So your birth month would be the month prior, but it's a little confusing. But for most people, if your birthday's in June, then you just go back 3 months before then, or 3 months after. This is your window, 7 months total to enroll into Medicare. If you're on a disability for Social Security, then you are automatically enrolled 24 months after that disability occurs, or whenever they recognize that disability. If you're collecting Social Security, you will be automatically enrolled as well, and you'll be sent a card about 3 months before your birth month, so right around the first month of that 7-month window. If you're not collecting Social Security, I help you with this. I can help you enroll, either going online and filling out the application with you, or we can call Social Security together to apply. And changing coverage. If you've already had Medicare, you're looking to change, there's annual enrollment. This occurs every year, October 15th through December 7th. Right now, we're right in the middle of annual enrollment. So if we made a change today to whatever plan you had, we could start that plan January 1st. Any change done during this time usually starts January 1st. So you can go from one Medicare Advantage plan, also Part C, that's what it's called, to another, or you can go off of Medicare Advantage and go back to original Medicare and get a drug plan by itself, or you can get a Medicare supplement plan, but we can go over what supplements and Advantage plans are here in a few slides. Another way outside of the annual enrollment period to change your coverage is a special enrollment period. Typically, if you're moving outside of the service area, You can change, you just let me know before you move and we can coordinate that. Whether you're moving, down south or just outside of the state and you're not sure, just let me know and we can figure out what plans are available to where you're moving. You have up to 2 months after your move to make a change to your plan. Same goes if you're retiring or you're losing other coverage, you also have up to 2 months after to make a change. So we'll go over what Medicare covers and what it doesn't. Pardon me. So this is original Medicare that we're talking about. If you had nothing else and you just had Medicare A and B, your card would look like this. You'd have A, which is your hospital. You're admitted into the hospital. You have roughly a $1,500 deductible that you have to meet. And this is each time that you're hospitalized. You meet that deductible and then Medicare will start paying. Again, this is if you're outside of the VA and you're just in a civilian hospital, you get hospitalized, you pay $1,500. You don't pay anything to have this Part A on your card. So you have some coverage. As long as you worked for 10 years of your life and you paid into taxes, you're entitled to this Part A. So like I said, it's partially funded by you paying taxes, but it doesn't cover everything. There's supplements we can talk about on how to cover this cost right here, the $1,484. The second part of Medicare is Part B. This is your doctor or your outpatient. You take an ambulance, your urgent care, chemo, anything outpatient is going to be Part B. There's a $200 deductible that you have to meet. This is calendar year 203. And once you meet that, Medicare goes to an 80-20 split. So Medicare will pay 80% of the bill. You pay 20% of whatever service that you have done. Medicare Part B is the one that costs you money. So if you have that on your card, you're probably paying $148.50 every month. Unless you're really low income or really high income. Low income, you can typically get that paid for by the state. I can talk about that in the limits at the end. Or high income, if you're making more than around $87,000 a year for a single person, then you're going to pay more than that. And again, I can go over those situations one-on-one if that is going to occur to you. 176,000 is the married limit per year. The premiums for Part B are going to be going up from $148.50 to $158.50. Just like your Social Security income is going up 5.9% this year, so are your premiums for everything else. Taxes, everything's going to go up, but basically it's a wash. You're going to get paid more for Social Security and then you're going to pay Medicare more. So things that Medicare doesn't cover, I told you there's an 80-20 split. 20%, that's the most scary part for people. If you're not going to the VA, you're going outside of the VA. You just have that one Medicare card. You have a surgery, you pay 20%. If it's a $100,000 surgery, it's 20%, no max. You just pay until the bill's paid. That's why just having Medicare alone is usually not a good idea. We can go over the two options you have. Medicare also does not cover drugs with A and B. No prescriptions. You have to actually get a Part D component. Part D stands for prescription drugs. And then it doesn't cover dental, vision, hearing. The only things it does cover for these are going to be medical, like if you have glaucoma or cataracts. That stuff is covered because it's a medical issue, but not routine dental, vision, or hearing. Doesn't pick up glasses, contacts, hearing aids, and then Medicare is not recognized, not recognized outside of the US. All right, so here are the two different options. I say two different options, but there's 100 different plans out there. It's super confusing. The first option, these are supplements. These are offered by almost every single insurance carrier. If you were to take a supplement, you're not using this at the VA or anything like that. You're just using this outside wherever Medicare is accepted, and Medicare is not accepted at the VA. You take your Medicare card, and you use that as a primary. And then you use your supplement as a secondary policy just to pick up that 20% cost. But because you're picking up that 20% cost with the supplement, you're paying a premium for these. If you've heard of the word Medigap, that is the same thing as Medicare supplement. They come in a bunch of different letters. There's G or F or N. Really confusing. Just know that if you have a supplement, you're paying for it. You're basically paying in advance to make sure that you have no 20% cost later. It doesn't cover any drugs or dental or vision. So after you're done paying the supplement, which is around $100 to $200, depending on your age or your zip code, then you have to tack on another cost, a drug plan. And these plans are ranging from $7 all the way up to $100, and it depends on what drugs you're on or prescriptions you're taking. That is the first option. So Medicare card up here, primary. Secondary is your supplement, and then you have a separate drug plan. If you go with option one, you have 3 different cards. Most veterans or people with TRICARE will not go this way because they're paying for something they're not going to use, or they can go to the VA for free. Instead, they'll go with option 2, and this is called the Medicare Advantage plan. This is by far the most popular option because they don't have premiums. Typically, you're going to get this plan for $0. It's also called Part C, and they made it confusing, but if you think of it like A and B and D are in a complete plan for C. C stands for complete. You have one card and you use that at your doctor, your pharmacist, your pharmacy, the hospital, the gym, wherever you go, you take that one card and you're covered. You do have to, do I need to go back there? Okay. You still have to have Medicare to be able to take this plan right here. All right, next page. So these Medicare Advantage plans, typically, I said they come with $0 cost. They have dental, vision, hearing, all of that stuff included. And some of them have gym memberships as well. And no additional cost. You just have to pay for your Medicare. So you have to have a Medicare card with A and B on it to qualify for this plan. Another thing, once you have A and B on your card, you take the Medicare Advantage plan. You have to be in the service area. Doesn't mean you have to use the plan within your service area. It just means you have to physically live in an area where that plan is offered. Once you're enrolled in that, you cannot be denied based on your financial or your health status. Pre-existing conditions do not apply to Medicare Advantage. You do have networks with these plans. So you just want to make sure, are you in network? Do they take the plan? The costs are going to be lower if you're in network. And then costs on each plan, there's 100 different plans, like I said, all of them are different. So no 2 people are the same. I do reviews with people. I look at what plan you're on. If you're not on a plan at all, we look at your prescriptions, your doctors, we make sure those are all covered and figure out which one you're comfortable with. And then most of these plans, well, all of them have an annual limit on out-of-pocket costs, which could be anywhere from $3,000 to $6,000, depending on the type of plan you take. So you know that if you're just on original Medicare, remember A and B, you have no limit. You can just pay and pay and pay. But on these Advantage plans, you have a limit. So at least you're capped at a certain limit. And then most of them, again, do not charge anything. You just have to pay for your Medicare Part B, which is typically pulled out of Social Security income each month. All right, so we'll talk about if you have VA coverage. So Medicare and VA are completely separate. They do not overlap. You can use both. I have tons of clients that use both. Most of my clients have VA coverage. They go to VA, they use VA all year long. They have a Medicare card with A and B, and they'll just enroll in a Medicare Advantage plan because it doesn't cost them anything in addition to having A and B. If they do that, then they can use their Medicare outside of the VA. If the wait list is too long to get into the VA, you go use your Medicare. If they want a second opinion, go use the Medicare. Or if it's an emergency and you're not near the VA, you can just use your Medicare plan. And then just showing you again the different options. Most people take this if you're using the VA, even if you're not using the VA. This is just a cheaper option and you get more of the benefits with it. Here are some of the advantages. So again, you pay $0. You just have to have A and B. You get the dental, the vision, hearing, and gym membership. Some of the plans even have over-the-counter products offered. Vitamins, Tylenol, toothpaste. There's some where you can get a Fitbit or a shower mat just included in the plan at no extra cost. They just throw in these extras for you. Another advantage is you can go outside of the VA. Like I said, different doctors and hospitals. You don't have to only be limited to the VA or to their wait lists. And then they also do have nationwide and some have worldwide coverage. So if you're overseas, they will reimburse you for whatever you have done overseas in the event it was an emergency. And then the last thing, a lot of plans that are offered for veterans, there's a few of them that will actually give you a give back benefit. You might have heard this advertised where they give you a Part B premium rebate. They'll help pay for your Medicare up to a certain amount. You can't get any money. You can only get up to the $150, but a lot of the plans are actually less than that. I could go over that in specifics with you one-on-one if you guys have questions on that. Late enrollment penalties. So the downside, if you do not take Part B, it's something I just want to make you all aware of. You technically do not need to take Part B if you only want to go to the VA. If you only go to the VA, you just have Part A. You just cannot go to a doctor outside of the VA. And if you do that, you don't have Part B, you get a penalty from Medicare when you decide you take it later on. It's 10% for every month or every 12 months that you do not have it. 10% of the premium I told you, which was $148.50. So that would be roughly $15 for every year that you don't have Part B. If you've gone 10 years and you decide to get it now, that's basically double your premium that you're paying from there on out. It's a lifetime penalty. Same thing with Part D. You have a penalty for not taking a drug plan. However, the VA does count as creditable coverage. So even if you haven't had a Part D for all these years and you decide to get a Part D plan, which is drugs, then you don't get a penalty. Did I lose anybody? Should I stop there? Keep going? Okay. Anybody here on TRICARE for life?
Yes.
Yep.
Yes.
Okay. So TRICARE for life. If you have TRICARE for life, you have two different options. Most people will just use their Medicare A and B as their primary coverage. You go to a doctor that takes Medicare, use that primary, and TRICARE will pick up the cost for whatever Medicare won't. So that big deductible I told you about, TRICARE will pay second. And TRICARE also covers your prescriptions. That covered right there works nationwide just fine. The other option for people with TRICARE for life is to go with an Advantage plan. If you go with the Advantage plan, you just want to make sure you take one that doesn't have drug coverage because you do not want TRICARE to stop paying for your medications. There's a couple Advantage plans that do not have drug coverage that are specifically geared towards veterans and TRICARE for life people. Those plans have those rebates. So instead of you're not paying anything for the plan, but they're giving you $50 back every month just to be enrolled in that plan. The downside of that plan is you have to make sure your doctor will at least bill the plan as primary. So do they take that specific plan or will they bill it? It can be in network or out of network. But you would basically be using Medicare Advantage instead of Medicare A and B as your primary, and then the rest of your copays or co-insurance would be picked up by your TRICARE for Life. So really the cost is the same. They're paying you to take the plan, and then you get dental, vision, hearing, gym, and all those extra rewards I was telling you about. And again, you can add this plan during this time period, and then you can drop it as well. So just an illustration, if you have TRICARE for Life, there's no sense in paying for a supplement over here, option 1, because TRICARE for Life is basically a supplement. It's covering all your costs at 20%. You would want to take a Medicare Advantage plan that doesn't have drugs included. All right, I'll talk about a couple different programs here that people with low income could qualify for. So if you're not low income, maybe you know somebody that is, that could benefit. There's 3 different programs. There's Extra Help. This is help with prescription costs, Part D. If you're low enough income, they will help pay for your prescription plan and for the copays. Typically the limits are around $1,600, but it really depends on how much money you have in the bank as well. Again, if you send them to me, I'll help them apply for any of these programs. The second one is Medicaid. This varies by state. The limit in Colorado is around $1,200 a month that you can make, and they have a formula. So if you have more than $2,000 in the bank, you don't qualify. But again, send them to me and I'll help them apply. The last one is probably the most important. If you are less than $1,500 here, $1,469, and you have less than $10,000 in the bank or IRAs or annuities, cash or stocks, then you get qualified for your Medicare Part B premium to be paid, that $148.50. I would help them apply, and then they wouldn't have to pay anything for their Medicare, and they can opt to take that Medicare Advantage plan for 0 cost, depending on which one they take. We just want to find one that the doctor takes. Okay, so with that, I will just take a bunch of questions, I guess, for 20 minutes or so. Hopefully I didn't confuse you all, but that's why.
This is Bonnie. I have a question.
Okay.
You keep saying that Medicare Advantage has no cost. No
Right.
cost. So what is the cost? A and B?
Right. You just have to have A and B.
What's out of pocket? I don't understand that. No cost doesn't compute. There has to be a cost.
So there is. So each plan has certain copays for certain line items. So I can't get into the specific plans, but I can one-on-one. I'll just say that the Medicare Advantage plans don't have a cost to take them. You just have to have your Medicare card, right? You have A and B, you take a Medicare Advantage plan, and then you pay the copays on the plan. So like most employer plans that you're on right now, or are you on a plan?
I have just turned, and so I'm still, Deers doesn't have me in the system yet, so I can't choose TRICARE for Life, but that's what I would be.
Okay.
I just am waiting for them to get all the things in order.
So most health insurance plans are, $0 for a doctor or $30 for a specialist. You get hospitalized, you pay a couple $100. Each item on the plan has a certain copay with a limit on the plan of a max out of pocket. You cannot pay more than this in a given year. However, if you're on TRICARE for Life, those don't really apply to you because all of those copays that you would typically pay would be picked up by your TRICARE for Life. So Medicare Advantage.
How does TRICARE for Life and Medicare Advantage, I don't understand how those combine. or work together
Sure.
in cost wise?
So cost wise, you just have to have Medicare A and B, which you're gonna have to do. You have to enroll in A and B to get TRICARE for life. And then you have the option of just keeping it like that, or you can enroll in the Advantage plan. So Medicare will be paying the Advantage plan to then give you a plan that has dental and vision and everything else. You just have to make sure you use that Advantage plan at doctors that take it, and then TRICARE picks up the extra bills.
What dollars? Because right now I'm just hearing that the Part B is the $148.50 or $150. So how much does Part A cost? And the Medicare Advantage is no cost at all. So the whole thing only is $150?
Yeah, Part A is premium free. If you work for 10 years of your life and paid into taxes, you're good. And then it's just $150 for Medicare. And you can keep it like that, or you can go one step further, get an Advantage plan, which will give you all of those extra things they're zero. Most of these plans are zero. Few of them will actually give you additional money back towards that 150. So some of them will actually pay you to take it.
So Medicare Advantage is always free? So you're getting everything for $150 a month,
Right.
right?
Right.
That
And you just
sounds too good to be true. I'm waiting
Well, I
for,
mean,
okay, where's the thing that didn't?
Well, Annette can speak to it. I mean, she's on it on a plan, right? And how do you like your plan? I mean, you just pay Medicare, right?
I just say, well, yeah, I like my plan. I actually don't use the VA. And yeah, so right now my plan is at like $148 a month. So, but because of my disability, I mean, I can use the VA. I just don't, because it's more convenient for me to get into the doctors like today when I need to go in, instead of waiting 3 or 4 months to see specialists. And also because, some of you on here understand that I have some specialty medical issues. So the VA, for me to get in there for what I need would take months, where it's only like a week for me to get in outside. You know what I mean, on the civilian side. So my Medicare A and B are great. And I've not ever had, in the 20 years I've lived here, 20 plus years I've lived here, never had any problem with even in an emergency, if I'm not at home and I need to go to the doctor to an emergency room, I've never had a problem.
So you're on a Medicare Advantage. And so we're talking about company Blue Cross Blue Shield, and that's the Medicare Advantage that we're talking about.
I'm United Healthcare. So
Pardon?
for me, I'm with United Healthcare.
Okay, so let me show you a specific plan. Are we still recording? We stopped the recording. Let me open it up. Where is it?
You want me
Ronnie,
to
when
stop
do you-
recording?
What's that?
Did you say you wanted me to stop recording?
Yeah, is that possible? I technically cannot go into the plan details, but if we're not recording, I'll bring up a plan. I'll give you an example.
Okay,